Millions of people are affected by natural disasters every year. From the destruction of infrastructure to the spread of disease, natural disasters can devastate an entire nation overnight. In May 2016, floods and landslides caused by torrential rains wreaked havoc in Sri Lanka. Over 420,000 people were affected, 100 people lost their lives, and 100 people remain missing. The health sector, together with the Triforces, played a crucial role in the disaster response by dispatching emergency medical teams to affected areas. The World Health Organization is providing critical support to the Ministry of Health to further strengthen national emergency preparedness and response capacity. On the 26th of August 2016, the WHO Country Office for Sri Lanka donated 4 medical camp kits or mobile hospitals to the Ministry of Health to enable first responders to provide emergency care to disaster survivors and ensure the provision of basic health services to the population in disaster-affected areas. Medical camp kits consist of 4 IEHK supplementary units and 40 IEHK basic units. Each medical camp kit allows for the treatment of 10,000 patients for a period of 3 months. Each kit is equipped with 5 tents, foldable chairs and beds, mattresses, hygiene kits, solar panels, a portable generator, fridge and water tank. To expedite the deployment of medical teams to affected areas, 170 personal deployment kits with essential supplies were also donated to the Ministry of Health. To strengthen the infection prevention and control capacity of the Ministry of Health, WHO provided 2,500 personal protective equipment kits in addition to providing comprehensive training. Each kit carries a range of items such as heavy-duty gloves, coverall, rubber boots, face mask and protective goggles. 4 inflatable boats were donated to support the quick deployment of medical teams to affected areas. 50 fogging machines were provided to the government to ensure greater outreach for mosquito control, thus reducing vector-borne diseases in the aftermath of disasters. 52 mother and child clinic sets, 64 health post kits, 6 surgical kits, 7 emergency medical equipment sets, cold chain equipment were also donated to the Ministry of Health by the WHO.
In May, I think all of us know that we experienced one of the worst floods in the history of the country. About 300,000 people were displaced. So some of the things which you'll see this afternoon is a complete kit, a hospital, which you see here. So there are 4 complete hospitals which can be built during emergencies. So we are very pleased to support the Ministry of Health with all this effort, and we know that the efforts taken by the ministry will, not only the Ministry of Health, the Ministry of Defense and other sectors, will help Sri Lanka to be better prepared for the future.
Sri Lanka experienced one of the worst disaster situations in its history in May this year. Sri Lanka received much help from many countries near and far, with WHO Country Office playing a major role in coordinating the process. And today, WHO is taking another step by handing over a host of medical supplies, including 4 mobile hospitals, thus strengthening its emergency medical response capacity. In conclusion, I wish to thank our WHO Country Office and the resident representative, Dr. Jacob Kumaresan, for working closely with the ministry during the recent disaster and continuing to support us in our rehabilitation effort. Thank you very much.
WHO will continue to support the government of Sri Lanka to strengthen emergency preparedness and response and national core capacities for emergency risk management.